Good morning, Chairman.
Morning, Joseph. Thank you for that. Good morning, everyone. Happy New Year. I hope you've all had a fantastic time with your families. Good morning and welcome to this meeting of Adult Care and Public Health Scrutiny. I am Councillor Jimmy Brooks, the Chairman of the committee, and sitting to my right is Councillor Maggie Cullen, the Vice Chair. We've also got Councillor Steve Clegg, Executive Councillor for Adult Care and Health, as well as Councillor Maria Hume, Executive Support Councillor for Adult Care and Health. We've also got, just checking, Martin Samuels, Executive Director of Adult Care and Community Wellbeing. Before we begin, there's some standard announcements. If there is a fire alarm, it's not a test, so please leave out the doors there. If you see me running that way, you know we're going that way to the car park, and please wait further instructions. The audio-visual feed of this formal public meeting is now broadcast live, and all your comments will be on there forevermore. Please have any mobiles and laptops and iPads on silent mode, and the hearing loop is now activated. Requests to speak will be collated by the top table, which will be Councillor Cullen. Please indicate early if you wish to speak. We will now move on to the formal agenda. Thank you. Joseph, have we got any apologies, please?
Yes, Chairman. We have apologies from Councillors Lichfield, Young, Overton and Redfern, with Councillor Robinson standing in for Councillor Lichfield.
Thank you. Declarations of member interests. Do we have any members wishing to declare any interests? No. Thank you very much. Agenda item 3. Minutes of the meeting of the Adult Care and Public Health Scrutiny Committee held on December the 3rd. This item is to be approved and signed the minutes of the last meeting as a correct record. Please turn to page 5 to 14 of the agenda pack. Do I have a proposer? Councillor Reeves. And do I have a seconder? Councillor Robinson. Thank you. Could we all now vote in favour? Please show of hands. Anybody against? Any abstentions? No, that's carried. Thank you very much. Agenda item 4, announcements by the Chairman, Executive Councillors and Lead Officers. Chairman's announcements. At the Executive meeting yesterday, I gave a report to the committee, which was well received. The leader, Councillor Matthews, asked to pass on his thanks to the committee for their work and diligence you bring to this committee. We also had Councillor Clegg, Executive. Thanks to all the committee members from all parties for their valuable and informative contributions, and thank you to everyone for that. Executive Council announcements. Are there any executive announcements?
No, Chairman. Thank you.
Thank you very much. Martin Samuels, have you got any announcements, please?
Thank you, Chair. Members of the committee will be aware that I've been giving regular updates on our inspection by the CQC. Since the last meeting of the committee on the 3rd of December, we hosted the CQC for the on-site part of the inspection. They were with us on-site from the 8th to the 11th of December. There were about half a dozen inspectors with us. During the course of that time, they interviewed scores of staff, a number of partners, a number of members, and perhaps most importantly, a number of individuals with lived experience. I'd like to take this opportunity to express my thanks to everybody that was involved, members, partners, staff, and of course, most particularly, people with lived experience. The process ran very smoothly. We did have one slight bump when something didn't quite go right, but it was very quickly resolved. So the process went very smoothly, and the CQC were very complimentary about the whole running of the process. We have not received any formal feedback from the CQC. They run a very different process from Ofsted. I am due to have a phone call with the lead inspector on Friday of this week, where I will receive informal feedback, and I should be clear both that informal feedback will not include a provisional rating, and it will not be something that I will be allowed to share in any detail because it's informal feedback. We will receive the draft report around about the middle of February, and there's then a period of about a month for that report to be checked for accuracy, for us to make comments and for CQC to respond to those. So that will take us through until middle or end of March. CQC has said that they will not publish any reports nationally during the pre-election period, which starts at the end of March, even for areas which are not undergoing elections, such as Lincolnshire. Therefore, it is possible that our report with a rating will be published at the very, very end of March. But I suspect it is more likely that it will end up being published in early May. Clearly, as soon as the report is published, I will then bring that that report and a covering report to this committee, and obviously the committee will be able to ask whatever questions it wants. But as I say, CQC are very, very jealous that nothing can be said publicly about the ratings until they themselves have published the report. It may be late March, but my instinct would be to advise the committee that early to mid-May is more likely. Thank you.
Thank you, Martin, for that. Do we have any members wishing to ask any questions on the announcement, but nothing that is relevant to be considered later in the agenda? No. Thank you very much. We'll move on to the next item. Agenda item 5. External commissioned building-based daycare procurement. This decision scrutiny report can be found on page 15 to 38 of the agenda pack. This report seeks approval for the external commissioned buildings-based daycare procurement. This decision is due to be considered by the Executive Councillor for Adult Care and Health between the 12th and the 16th of January. The view of the scrutiny committees will be reported to the Executive Councillor, who is here present as well, as part of the consideration. Martin Park, I do believe. Thank you very much, Martin.
Thank you, Chair. Morning, Chair, and morning, members. Yeah, here to present the procurement of the externally commissioned building-based day services. I propose to keep my update brief and take you through the key points before I hand over to Carl to take you through more of the commercial procurement elements of the report. But effectively, the report sets out the proposed approach for re-procuring daycare services delivered by the external providers. These services are vital for supporting adults with eligible care needs under the Care Act of 2014 and providing the respite for their unpaid carers. Just to give you an overview of what the current position we have within the County Council. So currently the Council commissions daycare through an open select list with 18 providers operating across 37 locations throughout the county. The existing contracts expire on the 31st of August 2026 and there are no options for an extension of those contracts. The annual budget set aside for these services is £3.4 million, and this supports approximately 295 LCC funded individuals alongside self-funders and those using direct payments. The reason that a re-procurement is suggested or recommended is that the do nothing option is not an option. If we fail to re-procure, services will cease after August 2026, impacting nearly 300 people and their carers. This will also undermine our market sustainability, which is a statutory duty under the Care Act, and therefore we may be failing to provide needs of those people within that Care Act. So our proposed approach is a full re-procurement for a 2-year contract commencing on the 1st of September 2026, with an option to extend for up to 2 years. This interim period will allow us to maintain continuity of care while we work with providers to redesign services to a more flexible community-based model. Those members in the committee will know that adult social care has gone through some transformation in terms of thinking in more of a preventative early intervention activity work. And our strategic position around daycare, day opportunities, more looking at a community-based model. So not just thinking about traditional building-based care, but thinking more broadly around what community opportunities are there for people closer to their home, connected with their communities. This re-procurement kind of aligns with that also. So this will enable us to be more targeted outcome-focused support, reduce long-term dependency, and connect daycare with other services such as short breaks, shared lives, and digital solutions. So before we go on to questions, I'll just hand over to Carl just to provide some extra detail around the procurement.
Thank you, Martin. So, yes, in order to realise the change from more traditional externally commissioned buildings-based daycare to a broader and more flexible community opportunities model, there will need to be a period of market shaping and support and development, and the recommended interim contract approach will provide a platform for us to work with the market and other key stakeholders to develop and to finalise plans for this future strategic commissioning approach. Review work has concluded that the current model generally works well, and to ensure continuity of provision during this period, the proposed contract model will broadly mirror the current mechanism. It will utilise an open framework model that enables the market to remain dynamic, which will maximise choice and geographical coverage of services available within the county. The pricing structure will continue to have two core capped rates linked to broad categories of care to distinguish between differing levels of need, alongside a one-to-one support rate and a maximum daily support rate, that being the maximum payment for one full day session, irrespective of the amount of one-to-one support that an individual might require. Subject to the ceiling rates to be applied to the services and a commitment to deliver the service requirements to the required standards, the final cost of services for each provider will be determined by the competitive tender process. Now, because the council sets the capped rates for the services, contract rates will be subject to annual review and uplift, recognising inflationary cost pressures, and that's built into the medium-term financial plan with an assumption of an inflationary increase aligned to that approved for other community-based support services. Where providers do offer additional services and there's flexibility to be built into the contracts to enable that, things like bathing, hairdressing, cooked meals, and indeed transportation to and from the settings, and the council will only fund the additional costs associated with those extra services where they form part of the assessed need for an individual. Contract management of the services will be prioritised according to risk. Every service will have an allocated contract officer, and risk will be determined through contract management data to be supplied by the providers of the services, as well as considering feedback from social care practitioners and users of the services, site visits and other third-party data. And a key improvement during the interim contract period will be the introduction of an enhanced reporting framework, including more and improved systematic reporting on referral and service delivery trends, particularly across the core categories of care provided, to support us to undertake more robust demand planning and forecasting for future requirements for this type of service. Thank you, Chair.
Thank you, Martin, and thank you, Carl, for that. I would like to invite members now of the committee to make any relevant statements or ask questions. Do we have any speakers? No? Councillor Cook.
Sorry, thank you, Chairman. Happy New Year, everyone. So I think my questions are really around, and thank you for the presentations, by the way. So how confident are we that this sort of meaningful shift to a community-based model can actually be delivered within a 2 to 4 year interim contract, given the scale of sort of the market shaping required? And Carl, you mentioned quite a lot in your intro about risk, and I suppose mine is, what is the contingency if the smaller providers struggle with the new procurement regime, and does this risk reducing that local provision that we're sort of looking for?
Yes, thank you. So, in relation to the market, it is a market that is made up of predominantly small local organisations who can struggle to navigate some of the complexities associated with public procurement regulations. What we'll do is ensure that we are having regular forums and opportunities for communication with the provider market in relation to the tender process to ensure they're fully aware of the requirements of submission for compliant tenders. And we will build on that throughout the term of the next contract to work with them to get their views, their feedback, and to support their development to shape the future commissioning intentions for this community services model. So yes, we are reasonably confident within 2 years we can achieve that, but just to make sure that if additional time is required, we've built in the option to extend the interim arrangements for a further 2 years to really ensure that the market is coming with us and prepared to deliver the scope of services that will be required in future years.
Thank you. Thank you, Carl. Thank you, Councillor Cook. Councillor Cullen.
Thank you very much, Chair. Thank you, as always, for such a concise and detailed report. My question concerns the current providers, as they currently have a satisfaction rate of 8.6 out of 10. Are they able to reapply, and does the process protect service quality and continuity to ensure that we maintain the current standards? Thank you.
Thank you. Yes, yes, absolutely. We want to bring our current provider market with us. So existing contracted providers will absolutely be able to participate in the forthcoming tender process and will be supported to understand the requirements, both in terms of the service specification and the submission requirements for the tender process, and in terms of the assessment of the proposals from both existing and prospective new suppliers, providers of these services. The assessment of proposals, tender submissions will be fair and transparent. Consistent criteria will be applied to all submissions to ensure that we are awarding contracts to providers that can demonstrate they understand and can fulfil the quality standards for the services that the Council requires.
Thank you, Carl. Thank you, Councillor Cullen. Councillor Bean.
Thank you. Happy New Year to everybody, and thank you for the reports. I see at point 7.3 on page 30, you talk about transport and the problems that individuals face in accessing services. Specifically, what plans have been put in place to help people access services across what is quite a large county throughout this contract, please?
Thank you. Yes, I mean, there's no doubt that transport and accessibility to services in a large rural county, and not just these buildings-based daycare services, but services more generally, can be challenging. We're going to, during the new contract term, we will review and update the transport policy and explore options, including both provider-facilitated transport, and there's an opportunity for providers who can facilitate transport and access options for people who use services to make those services available as part of their contract offering. as well as things like voluntary car schemes, independent travel support, the aim being absolutely to improve accessibility and reduce barriers. And it's also worth noting that the model more generally supports the management of service accessibility, including demand for transportation to and from services by seeking to maximise choice and geographical coverage of services available within the county, making sure that we've got service options available within local communities across the county.
Yes.
So, do we have any idea of what the anticipated annual cost of this transport is going to be?
So the transport budget that sits outside of the core service budget for this will remain consistent. A lot of that is to support users to access in-house daycare services for clients who are requiring support to access these externally commissioned services. Where it forms part of their assessed care and support need, we predict an incremental growth in demand through the duration of the contract, but that's not anticipated to significantly impact the overall budget for the services.
Sorry, do we actually have any figures for an anticipated annual cost throughout this contract?
There is a figure included in the report, if I can just find that. My apologies.
In the interest of moving things on, you can always send the figures to me if you would like.
We'll do that, absolutely.
Thank you very much.
Thank you, Councillor Bean.
Thank you, Councillor Bean. Thank you, Carl. Carl, could you send that to all members, please?
Of course, yes.
Thank you. Councillor Robinson.
Thank you. Yeah, just regarding, I think it was 2.15, just regarding the specialist support services. Is there data showing which specialist services are in the highest demand, and how is that used when awarding the contracts?
Yeah.
Yeah, so we do have data. The current data shows the high demand is for autism support and profound and multiple learning disabilities and challenging behaviour services. So they're the key elements that kind of sit within the demand profile. This intelligence does inform the contract design and will be used as part of our evaluation criteria moving forward to ensure that those providers can meet those specialist needs. So that will be built in. So we do use that evidence. And as Carl said in his brief, we're hoping to increase that in this new contract in terms of getting better provider information from the providers through the new contract.
Thank you, Martin. Thank you, Councillor Robinson. Councillor Woolley.
Thank you, Chairman. I think I have 3 questions, so I'll do them one at a time. First of all, are any of the daycare centres likely to close? And if so, which ones?
Is that in relation to internal or external daycare centres?
That, as far as I'm concerned, it doesn't matter whether they're internal or external, simply because it's where residents are going to be going. So either or both.
Yes, so no decisions have been made on any closures or of any daycare centres. The whole county picture is being reviewed. So again, it's looking at our evidence. What is the need? and therefore where do we need that need, and then how can we best supply that?
Can I just come in on that? I mean, just in terms of the external provision. So this is entirely about external provision. We will in due course be looking at the internal provisions, but this is purely about the external provision. As Carla said, we run an open supply list, an open service list. So any organisation which is able to provide a service that meets the standard can be on the list. And so all of the current providers, if they wish to continue, can apply, and if they meet the standard, they can be on the list. So were there to be any current services that were to stop, that would either be because the organisation had decided not to bid for the new list, or because they didn't meet the standard. And clearly you wouldn't want us to have services that didn't meet the standard. But it is very much on the basis that if you meet the standard, you can be on the list. So if there were to be any closures, it would be purely because the provider decided that they didn't want to provide the service anymore, or because they couldn't meet the standard. So there's no plan to close anything, if you see what I mean.
Thank you, Martins. Yes, I do see what you mean, but I would still say, well, I would query that if there is a standard at the moment, is it going to be so very different a standard as we look into the future?
It's basically, so for this contract, it's the same standard as now.
Right. Okay. Thank you. Next question is around the number of assessed eligible people accessing daycare. What, as a percentage of the total number of people who could access daycare if they wanted to, is this 782?
Shall I come in on that as well? So I think I'm going to draw a distinction between people where a day opportunity is part of their assessed package of need and people who would like to attend a day opportunity. So for people where this is part of their assessed needs, so they've gone through a care assessment and the social worker said, in order to meet your care needs, I think attending a day centre is the right thing for you, then if that is what the social worker has said is part of the care need, then we have an obligation to make sure that it is available. So there may be people who would say, actually, I don't really want to do that, but I would expect that would be few and far between. So for people for whom it is part of their assessed need, 100% near enough would have access to either the in-house service or the external provision, depending on what was appropriate for them. Then there are people who might feel that they would like to access day services, and as Martin has pointed out, these services are available to self-funders if they choose, but it is something that they choose and they pay directly for it. They don't do it through the council. They would have a direct relationship with the provider. So in terms of, because that is nothing directly to do with the council, I wouldn't really be able to be clear about whether people had access or not. But essentially, that would be a matter for if people wanted it and they chose to buy it, then it would be there for them. But it's not the council's responsibility to ensure that that is available, if that makes sense.
It does, but I'm not sure that was the answer that the question that I asked. Of the 782, it's the people who have had an assessment that says they are entitled to daycare. What percentage is that 782 of the total?
So I would say that if they have been assessed as needing daycare, then they will get it. So 100% of people who are assessed as needing daycare will be receiving daycare unless they have chosen not to have it.
But we don't know, again, it's that what numbers have been assessed do need daycare but choose not to have it.
I would imagine, that we don't know, I would imagine the numbers would be vanishingly small.
Can I leave that one with you, just out of interest? Thank you. And then finally, the recommendations, unless I'm reading this, it's a Mars and Venus thing or whatever, the recommendation 1 seems an awfully big difference between £6,800,000 for the initial 24 months to 13,600,000. Why such a large amount? Because it doesn't imply, it implies, the way that I'm reading it, that that is for that 24 months. It doesn't imply that it's 6,800 for 24, but could be 13,600 for a longer period. So can you just clarify, please?
Yes, it's 6.8 for the first 2 years. If it were to be extended to the full 4 years, it would then be the 13.6.
Thank you. Thank you, Chairman.
Thank you, Councillor Woolley. Thank you, Martins. Councillor Lee.
Thanks, Chair. I appreciate that this is a report about commissioning a service, but my question's more around the people, really, because I might have missed it. It's a big report. Page 20.1.5 talks about the value of the service to users and carers, and page 24 talks about service reviews. You know, it's reviewed and they think that the travel's problematical. I just wondered if, and I could have missed it in here, if there's perhaps maybe an annual appraisal of the service user, if that's the right term, and the carer to see what they feel the benefit is. You know, like at work, you'll have an annual appraisal. This is what I want to do next year. Have we achieved this? I'm looking at the value, because this report doesn't seem to say a lot about the value of the service to the people who use it, and actually to the carers. It doesn't go into a lot of detail. That's not a criticism, but I just wondered if that was monitored, you know, as part of this whole process.
So it is through social care reviews in relation to the services that individuals receive and the achievement of the outcomes identified for those individuals. What we do want to do through the enhanced provider reporting framework as part of the new contracts is try and elicit some better service user outcomes information to support our assessments, our ongoing assessment of the effectiveness of service performance. Obviously, that will run alongside the existing reviews that happen for individuals and their carers as part of their support planning and their ongoing support planning process.
Come back on that, because I just think this is such a badly needed service, not just for the users but for the carers. They're under huge pressures, and I can see that often the transport arrangements, who wants to sit in a wagon that's going around like 26 different places for 3 hours to get somewhere? I get all of that, but I hope we don't undervalue what this adds. I know quite closely within my family someone who's a carer, and this sort of thing is very, very badly needed.
Yeah, absolutely. And you know, as some quite significant engagement that happened with public and people who use the services in preparation for this recommissioning process, and will continue to help inform the development of the future community opportunities model.
Yeah, thanks. I asked with positive intent, not to criticise.
Thank you.
Thank you, Councillor Lee. Thank you, Carl. No more speakers. I'll just ask a quick question, if that's okay. If the council ever decided not to recommission building-based daycare, what legal checks have been carried out to confirm we would still fully meet the Care Act duties without creating service gaps in or increasing pressure on the residential care? Thank you.
So if I can pick that up. So if someone's individual assessed need says that they need daycare, then the council has a legal duty to deliver that. So, or rather, to ensure that it is delivered. Important always to make the distinction between the council directly delivering something and arranging for something to be delivered. So if it is in someone's individual assessment that they need daycare, then the council has a duty to ensure that that person receives daycare. So what we are looking at, as Martin was saying, is we have a relatively traditional model of buildings-based daycare. Lots of other places in the country have moved away from buildings-based daycare to opportunities in the community. and that is what we are looking to design over the next couple of years. So we have an obligation to make sure that something is available that meets people's needs. It doesn't have to be the current model of delivery.
Okay, thank you, Martin. As there's no more speakers, I shall move on. Thank you for your questions and comments. This now concludes this discussion for this item. I move that the committee supports the recommendations to the Executive Councillor for Adult Care and Health as detailed on page 15 of the report, namely that they approve the proposed external commissioned buildings-based daycare re-procurement, and I move that the summary of our comments will be shared with the Executive Councillor for their consideration. Do I have a seconder? Thank you. Yep, Councillor Reeves. Could we all vote in favour, please? That's unanimous. Thank you very much. Agenda item 6, technology-enabled care tech service. This pre-decision scrutiny report can be found on pages 39 to 104 of the agenda pack. This report seeks approval for the report of the technology-enabled care service. This decision is due to be considered by the Executive Councillor for Adult Care and Health between the 12th and the 16th of January 2026. The views of the Scrutiny Committee will be reported to the Executive Councillor as part of its consideration of this item. The report will be presented by Martin Parker and Carl Miller.
Thank you, Chair. Yeah, so in a similar format, I will keep this brief as possible and allow Carl to do his piece as well and give plenty of time for questions. So the report sets out the proposal to move what, again, we talk about sort of traditional methods of care. So again, moving from a traditional telecare model of tech delivery to a more modern preventative tech-enabled care service. The approach certainly supports our adult social care strategy by promoting greater independence, reducing that reliance on formal care and traditional care need, and ensuring sustainability. That's not about kind of reducing the care that people get, but delivering their outcomes in a different way. So what our current position is in terms of our technology provision is that Lincolnshire's tech offer is largely reactive. And what I mean by that is that it's based on pendant alarms and basic sensors. So ultimately, when something is at an emergency and a support point already because something's happened, because somebody's had to press a pendant or somebody got into an emergency situation, that then does not give and provide great outcomes for individuals because they're likely to come into the care system, which might end up being more of a residential home or might end up being in hospital. And that's the things that we want to steer clear people from. So what we're looking to do is ensure that we take a more prevention of escalation of needs with the use of our technology and our technology provision. And this is what this paper kind of sets out and what we're looking to kind of procure through a strategic partner. So our existing contract ends on the 31st of August, so it does create that opportunity for us to redesign the service, deliver proactive preventive care. The delivery model that the paper is proposing is a hybrid model. So there are a number of in-house functions that are required, and then there's a number of external provider elements that are required. The external provider element is the procurement piece, and the in-house function is a recruitment piece. In-house functions is really around that service promotion, the referral of the referral triaging, the practitioner training, huge amount of cultural change, both with internal social care advocates and also external social care advocates. The data analysis that the tech is telling us about and ensuring that tech is embedded in people's care planning to make sure that we are considering it as part of their outcomes. The external provider is very much equipment sourcing, installation, maintenance, monitoring and innovation. And the provider will also maintain a retail offer for self-funders. Again, this is based on kind of modelling that's been done elsewhere, an in-house and an external provider. The council is not a tech expert, so we need to make sure we innovate and collaborate with a tech expert. It's not about a tech company supplying us with bits. It's more of a strategic contract around an innovation and methodology and making sure that we continue that growth over the 5 years. The model combines the council's strengths, certainly in care planning, and with that, as I said, technical expertise, ensuring flexibility and scalability. So just to talk a little bit about the target cohorts that the recommissioned service will look to seek to support. So as always, adults with eligible needs under the Care Act, where tech is the most effective way to meet those needs, but also thinking about more broadly around preventative cohorts. So how can we prevent people's needs escalating? And there's kind of 4 key areas that the Association of Directors of Adult Social Care kind of setting out a framework to say these are 4 cohorts that we think you ought to look at, because actually if you interact early with these cohorts, you are likely to reduce their need for coming into adult social care within 12 months, which is seen then as a positive outcome for that, maximising their independence, but also in terms of reducing the requirement for formal care needs. That's people that are receiving reablement who may deteriorate without technology. That's individuals with unpaid carers who need support to sustain caring arrangements. Young people with care needs transitioning to adulthood, and people recently diagnosed with dementia. So those are the 4 kind of key cohorts that ADAS highlight as there's a real opportunity for tech to have an impact on maximising their independence and providing them with better outcomes and delaying any formal care requirements. So this will ensure that tech is both used to meet the needs of those with Care Act eligibilities and also to prevent future escalation. So the benefits around tech, it improves the outcomes for individuals. Theo will talk about a couple of case examples just to bring some things to life that kind of demonstrates the lived experiences of the individuals that have used tech and how it's actually felt like it's reduced restrictions on them as a result of them having tech. So there's a real positive in supporting independence and choice. It's had an impact in terms of reducing social isolation and also providing reassurance to families and carers. So tech can have a real benefit on maximising that individual's confidence, independence and well-being. There's also a financial case and overview in relation to the tech is also compelling. So our current budget for the telecare service is £390,000 per year, and we're obviously proposing within this business case an investment of up to £9.3 million over a 5-year period, with an option to extend for 2 years. So those funding sources come from various elements to meet that 9.3 million. So we've got obviously the 1.95 million from existing tech budget over 5 years. So that's just a kind of a calculation up of the 390 of the traditional telecare budget that we've already got in baseline core budgets. We're looking to invest a further one-off contribution from the public health grant of 1.3 million, which then leaves us with a 6 million target in terms of realigning and reinvesting from traditional care such as residential care and also home care, and diverting that into the tech space. So that £6 million will come from a reinvestment and a realignment of our existing adult social care budget. So this is not an uplift in budget, it's a realignment of the work that we're already doing, because what we're expecting to say is that we will have an impact on people going into residential care, people going into home care or reduced home care packages. So there'll be a number of savings and there'll be a number of avoidance. So the cost per person is approximately £550 per year. That's including the equipment, installation, monitoring and maintenance. So what the contract is set out and how it's set out, the payment model is, it's mostly activity based. So actually if the costs will align with the actual take up. So whilst we've put in it's £1.5 million per year, that's the upper level of the budget. There's obviously the fixed costs that sit within that, but there's the large proportion of the costs is that flexibility of uptake. So actually if people aren't uptaking the tech service, then we're not paying for it. Obviously we do recognise with some of the benchmarking we've done elsewhere, actually the opportunity to uptake tech does give, as we've already demonstrated, better outcomes for individuals. There are some risks that do include the market readiness and the cultural change among our practitioners. And That's why it's really important to invest in an in-house team that's going to take control of managing that cultural change, managing that liaison with strategic partners, managing that liaison with the company, managing that contract management, being that kind of heartbeat of change to ensure that we embed this over the next 2 to 3 to 4 years, because that mitigates, the in-house team mitigates that risk of the market being ready and that cultural change that needs to be done. And they will be responsible for that early engagement, training and strong contract management. I'll just hand over to Theo, who will just kind of try and bring it to life a little bit by giving you a couple of case scenarios through the tech pilot that we ran about 18 months ago, wasn't it? Or over the last 18 months.
Just before you jump in, Theo, I'd just like to introduce Theo Jarrett, Head of Quality and Information. Thank you.
Thank you, Chairman. Thanks, Martin. So, yes, as Martin said, what we have done with this piece of work is not just take examples and information from elsewhere. We worked over a period of 18 months with a tech provider to really try out these new technologies that were different and new to Lincolnshire in all parts of the county and with all cohorts of social care users, so older people, people with physical disabilities, mental health needs and learning disabilities. So we've got a huge amount of learning from that. That pilot ended in the summer, but there are in the summer of 2025, but there are still people who have that tech who are still sustained by that. One of the big things that came out of it, obviously in the report, what you've got is huge numbers. You've got millions of pounds, thousands of people. Actually, what came through strongly for me, and also through the evaluation that was done by the University of Lincoln, was the actual impact that it can have on people's lives. And generally, people want to continue living their life, their ordinary life, to the fullest that they can. What we have seen very clearly is for people where tech is appropriate, and it's not appropriate for everybody, and it won't meet all needs, but where it does meet needs, it really does give an opportunity for people to live their lives as fully as they can. In section 4.2 in the report, what you've got is a few sort of very summarised case studies. As you can imagine, there's a whole story behind every single one and every single person who's been on the pilot and going forward. But in terms of benefiting from the tech service, there will be a person's whole life story that we're able to support. But I just want to focus on a couple, as Martin said. The first thing to say is that in terms of accessing technology, what we wanted to do is put practitioners working across the social care field in a position where they're confident about what can tech do, what needs can tech meet, and what is appropriate for the people that they're working with. So when they're in that position where they've got that knowledge, that confidence, what they will be doing, which is what they do anyway, they'll explore people's strengths and own assets that they've got within their own home. And in the first instance, that person could already have technology in the home, a smart speaker, a smartphone, light bulbs that come on. So it could actually be a very simple way. What we're talking about here is a tech service that where there are remaining needs, and we've explored all of those strengths a person might have. What we would say there is that technology service, it's another tool in the toolkit effectively that practitioners would have, in addition to looking at solutions like residential care, home care, daycare, as we've talked about. Technology is an additional tool in that toolkit. So what that practitioner would do is that they would be in a position to see whether it would help or not. So just a couple of examples as requested by Martin there. So these are real people who are living in Lincolnshire with technology at the moment that we've come across through the tech pilot that we ran. First example, an older gentleman, living with his wife in a supported living apartment in the village that he grew up in. He's got dementia. He's started to wander. What's happening is the staff at the supported living establishment are becoming worried about this. Sometimes can't find him. It's resulted in some police call-outs at some point. There was a plan for that individual, for that gentleman, to move into residential home, splitting him up from his wife. What we're able to do with technology, with his agreement, is for him to wear a GPS watch. What that has done is although he wanders, is able to be located. There's an alert that goes to the wife, to the staff at the supported living residence, and also his wider family, who live some distance away, are able to see where he is. There's been no emergency call-outs. They're still living in that apartment several weeks. I think it's 43 weeks later. So that intended move into the residential home has not happened. He's able to still live in where he wants to be with his wife. For younger people, it's very much around ensuring that they can do the things that they need to do to live a normal life. Got an example of a young man with a learning disability who's got some physical disabilities as well. He lives independently. He now uses an app that's a specific app to help him remember to do things, talk him through tasks where he might be panicking, have anxiety, and also use smart speakers that are wired up to this to help with tasks around the home. Also is able to connect to his friends more easily through these devices. What this has meant is that support hours have been reduced from 26 hours a week that the council was paying for down to just 7 at the moment. So there's still that support there. Technology doesn't always have to replace a person, but it's there to do the things that perhaps people want to do for themselves. So just a couple of examples, but there are more in the report.
And just finally for Carl, just to take us through the procurement piece. Thanks, Carl.
Thanks, Martin. Yeah, so delivery of the proposed new tech services contract will be by way of a single provider of a county-wide service, but the competition phase, the tender process, will not preclude bids from consortia and subcontracting models, which should help to maximise the level of competition and also enable small, medium enterprises and indeed local organisations to participate in the delivery or the competition for delivery of the services. That competitive tender process will also drive value for money and enable the selection of the best provider solution for Lincolnshire for the term of the service. Now that proposed contract duration is an initial term of 5 years. That's been identified from benchmarking and market engagement work that's been undertaken and identified as both attractive to the provider market and one which is functional and commonly used by other local authority commissioners for similar tech service arrangements, and as such that's what is being proposed for the new service in Lincolnshire. The payment mechanism, as Martin's mentioned, will be focused on activity-based payments to ensure that only the services that are required and provided are paid for, and monthly invoicing will detail all the activity in the relevant payment period to give us good oversight and visibility of that. Service delivery performance will be closely managed and monitored, utilising key performance indicators and associated targets as part of a strategic contract management approach, working closely with the successful provider on a partnership basis. Now, whilst there have been in the design of the service really rigorous and robust work undertaken associated with the development of projections around demand and benefits using the best information available to the project team and supported by expert consultancy and benchmarking advice. There are some residual risks associated with the accuracy of the presenting demand and the projections for benefits realisation, and that risk will be managed both through the activity-driven payment mechanism to ensure we're only funding the services that we are requiring, and through contract mechanisms that enable, if it's absolutely necessary, contract break or indeed modification to adjust the contract based on presenting requirements as we get into this new form of service. Thank you, Chairman.
Thank you for the presentation. I now invite members to ask any questions or make statements. Yes, we do. Councillor Cullen?
Thank you very much, Chair. Thank you all for the report, especially the examples. That was really interesting. Thank you very much. I just wanted to ask, regarding this new contract, how can we ensure that the current service users and, of course, new service users will continue to receive reliable quality support during and after the transition to a new provider, please? Thank you.
Yeah, I mean that's a really, really important part of the transition from the current service to the new service model, and we will be working with the new provider and aligning that provider's detailed mobilisation plan with the council's own mobilisation plans to ensure that we've got robust arrangements in place to support existing service users with clear communication through both practitioners and direct with individuals and their families, and onboarding the adoption of the new technologies. So yes, that is something that we will be very focused on, and we've also, allowed a healthy mobilisation period to enable that planning work to happen before the contract go live happens and the transition takes place, to make sure that actually all the pieces of the puzzle are in place to essentially ensure as seamless as possible a transition for those existing clients of the service.
Thank you, Carl. Thank you, Councillor Cullen. Councillor Reeve.
Thank you, and thank you for the report. Just after a little bit of clarification, on page 50, in relation to the Alexa with Vocala, it states that at £222 per week, 16 weeks to date, 5,425 avoided cost. Is that £222 the cost, or is that the savings? Because it seems an awful lot if it's the cost of an Amazon Alexa with a bit of extras on it. Thank you.
That's the savings. You're absolutely right. The majority of these devices, even though they might have been tweaked to ensure better data security and use in a social care setting, relatively cheap. So that is absolutely just that, just the cost of the care avoided.
Thank you, Councillor Reeves. Thank you, Theo. Councillor Lee.
Thanks, Chair. On page 41, you talk about telecare alarm pendants. Is that the Piper Lifeline that you mean? Yeah, I just wanted to ask, and this is a genuine question, because I know no one likes change, especially not old people. My mum had one of those, and it was for if they fell. And I can't imagine how someone, if they trip and fall, and that's why I wanted her to have it, I'm not sure how you could preempt or predict that. But I just wondered, given I can remember what my mum was like with technology, and they don't like change, people of that age that are getting dementia. Is there a process for sort of managing? Will they still be able to get Piper Lifeline? And what my question was, if they didn't, will someone help them into whatever they do get? Because you can just see, I'm sure it wouldn't be chaos happening, but you can imagine, can't you?
Yes, so you'll have seen by me nodding. Absolutely, this is what we have at the moment is around 1,400 people who are supported by the council, with things like lifelines, like other devices that you probably could have got 20 years ago, but we've still got them. And the reason why you can still get them nowadays is because they work. All of the devices that we've had on the catalogue have been transitioned from the old, people will have, members of the committee will have heard of the analogue to digital switch. That we've had that in Lincolnshire, so the lifeline that Mum's got is digitally enabled and will work with other providers going forward. So what we are saying is, what we want to do is we want to grow that. That 1,400 has been relatively stable over a number of years, with people new taking it on, but also people not needing it anymore for a number of reasons. What we wanted to do is to grow the catalogue of devices, so we're actually extending that range, but we're not throwing the baby out with the bathwater, as in, for those needs that are the emergency needs and for the reassurance calling for help, that will still be present.
Yeah, that was my point, because she did go into care, and she passed away. She was very old though. But my point was, it did help her stay at home for about 18 months and it wasn't the best system always, but you know, it worked and she could handle it. And I think that something too complex, elderly people who have got a little bit of dementia anyway, might not handle anyway. But if they've still got the option of that, then that's fine, yeah.
Can I just come in on that, just pick up the point you made about prediction? And you said, well, you know, it might be hard to predict whether someone is going to fall. Actually, the tech is really good at that now, because what we find is we don't tend to find that people can walk perfectly well and then they suddenly fall over. There's actually a deterioration in someone's stability and their ability to get around. And the sensors now can spot that there is a deterioration in someone's mobility that is likely to lead them to having a fall. And knowing that allows us then, I mean, so very often, actually that might prompt a drug review, because often people's instability is because the drug regime they're on means that at certain times of the day they're a bit drowsy, and actually if they just take their drugs at a different time of day, it can make a difference. Or we can say, well, there's a bit of kit that might be helpful for you to use a walker or a walking stick or whatever that would avoid a fall. Or to say, well, actually, we've got strength and balance classes that it might be helpful for you to go to, because you know there's no reason why you should be unstable in your walking, and there's something we can do about it. So in fact, clearly, while the lifeline arrangement that you're talking about can be a lifeline when someone has fallen, but the technology actually now increasingly allows us to predict that someone might fall and to take action before they fall, so that the fall never happens. And that's one of the key benefits of the technology. And it can be quite sensitive. I mean, you know, the sort of apps that we all have on our phones can measure your stability walking, and that's the kind of thing that we can tap into. So we can be very powerful from a predictive and preventative manner, and that you know, the potential saving from that can be enormous.
Thank you, Councillor Lee. Thank you, Martin and Theo. Councillor Robinson.
Thank you. My question was sort of answered by Councillor Reeve, so it's going to be more of an observation, really. I've checked the Vocala, Alexa. I had a look at their website, and that looks, you know, pretty good on there. And the Brain in Hand, I'd looked at some of the videos of how they work, and I think it's a very good example of what Theo said, is that technology doesn't necessarily have to fully replace care. And Brain in Hand is a good example that it deals with 90% of that, but it's just that 10% that we have to deliver and obviously bring that care. So, you know, the fact that it has your, you know, it gives your calendar. It also, you can put in things you're feeling during the day. If you feel a bit nervous, then you can put that in the app. That also helps with the therapy session. So that takes less time through the therapy to say how you're feeling, but you've already got it through those records. So I think it's a great thing that I just wanted to highlight. You know, Brain in Hand, it's a very good tool, and I can't wait to see it develop further. Thank you.
Thank you, Councillor Robinson. Councillor Bean.
Thank you, and thank you again for an excellent report. Looking at 6.2 on page 54, there's a small table there which splits down the in-house delivery and the externally sourced delivery. And I note it talks about monitoring for those that require it via a suitably staffed and equipped alarm response centre. I'm just wondering, who is going to monitor the company that's providing that service? The reason I ask is because in my previous career, we had companies monitoring prisoners who'd been released on tag or on licence with certain conditions, and on numerous occasions it was uncovered that they were charging us for monitoring people who were no longer using the service because they'd been returned to prison for breaching their conditions, and on one occasion someone had been dead for 6 months and they were still charging us to monitor that person. So I just want to make sure that we have steps in place to monitor the company to make sure we're not being incorrectly charged.
Yes, we absolutely do have steps in place. We've currently got telecare monitoring, part of the existing arrangements for the telecare service, that whereby we closely monitor the company providing that service. They are currently independent from the organisation that provides the supply, installation, maintenance of the equipment, and we get client data from shared with both organisations to make sure that we are fully aligned and the people who are receiving the services are being actively monitored and appropriately paid for.
Thank you. I suppose that our customers are a little bit more compliant. But I have 2 more questions, if I may. So, how will the council measure whether the expected preventative benefits from tech are actually being delivered, particularly with people who would not otherwise qualify for support?
Yeah, really good question. So we will be setting up, obviously, with our internal team around the monitoring that return on investment. So effectively, if we think about the pathway that, say, let's come from somebody from the reablement service, that gets assessed by an internal individual. If that then is monitored against data that we use to say, well, that person in that person's circumstances, based on the kind of industry framework that ADAS has built, is likely to require formal adult social care services, will have care needs within the next 12 months. But we think tech can reduce that, delay that, or prevent that in its entirety. They'll be then offered that technology, and then we'll track that person through that technology to see actually if they do then come into formal care. And it'll also happen in reverse. So people who do come in from a trusted assessor in those 4 pockets in that preventative methodology, if we decide that actually we don't think you're going to have a care need in the next 12 months, and we refer them to our tech partner to maybe buy their own technology, again, we're just working out how we might then still see when, well, if they do return in the next 6 months, actually what happened to them, and where did we get that wrong in our decision making of not recognising that they would have come in. So our internal team will be part of building the frameworks and making sure we've got all the right information and data of when that referral comes in, whatever decision is made, whether we support it through tech or we refer it for a self-funded tech because it doesn't meet our eligibility criteria, but we still track that individual if they come back into the system and when they come back in, and therefore we can calculate the avoidance of if they don't come in within the next year and they've then gone into residential care, what would have that potentially have cost?
Thank you. And my final question is, how will the tech model work with regard to people who are digitally excluded due to poor internet and intermittent mobile phone signal? And I ask this on the grounds of equality, really, in that all our residents should receive the same level of service, the same options, and experience the same service.
Yes, we've done quite some extensive work on the digital exclusion, certainly on the Wi-Fi ban within Lincolnshire, and knowing where that is. And Theo's kind of done a lot of work around where that exclusion is, and and then how we have to go about what is it that we can do with boosters or otherwise to try and get that digital exclusion band a lot lower. So the first thing is we know where that digital exclusion is, and then we have to build that into our planning in terms of, well, what then can be used, because what does that, is it about a Wi-Fi signal, is it something that we can use as and put boosters in, or a different type of service. The main thing is we've planned and mapped where those digital exclusions may be, which then feeds into then the problem solving of, well, then what can we use and how can we use it and how best can we support that. But ultimately that person's needs need to be met. And I say tech is just one option of a long list of options that can be used. So whilst we might not be able to use some of the digital activity, we still need to meet their needs in the best way possible.
Thank you very much.
Just to follow up on what Martin said, with an example from last summer where there was an outage of a specific a mobile phone provider, and some of the devices used with the current contract were working on that, because using that to connect people who had the equipment in their home to the responding service and the monitoring service. What the provider was able to do, and it had done this as a sort of a contingency planning before it happened, is those devices were able to switch between different networks and effectively use whichever one was strongest and was able to work in that area. That's an example that affected a number of people who were supported by the council last year. They didn't actually notice any difference when that network went down. I think it was for 4 days, and the service was continued. So what we would say is we've got that already, that contingency. Any strategic provider will be fully aware of that. We're going to furnish them with the information that we know we have about some of the areas in Lincolnshire where connection, either through physical, broadband, wired connection, is more difficult, or the over the airwaves sort of broadband is more difficult. But we have examples of where that's been an issue, and we've been able to get around it. That's what I'm just adding in there.
So you're talking about something like an automatic roaming service. Thank you.
Thank you, Councillor Bean. Thank you. Councillor Woolley.
Thank you. And I too have a number of questions, so if you'll bear with me. And Councillor Bean has actually touched on a point I was going to raise around there is evidence to show that a telecare or technology-enabled services can actually increase health inequalities, and not just through the digital side of things, but through the cultural side, through linguistics, etc., etc. So I would want to be assured what you've got in place or getting in place to make sure that those health inequalities aren't exacerbated. It's my first question, and I'll let you answer that before I move on.
Okay, thank you. Yes, through the pilot, we've had a specific part of that pilot that was running for 18 months, 17 months, looking specifically at to what extent people are excluded or not. On balance, what that found through the evaluation that was done by the university is actually digital can be more inclusive as a medium than maybe other types of care and support. But what we would be doing as part of the tender that we're putting out and the specification that we're putting together at the moment, as part of the procurement, is wanting a strategic partner that would work with us, who would be aware of the potential to exclude people, exacerbate any inequalities that people might have. So we would be looking at that going forward, working with them in order to make sure that people aren't excluded or disadvantaged through use of technology or not.
Okay. When will the service spec be available?
We've got a timeline for that at the end of January, when we're aiming for that service specification to be ready.
Okay, so if I've read the paper correctly, you are expecting to get the service spec out end of January. You've got 13 interested parties at the moment, which you are expecting to reduce down once the spec becomes available. And you want to have this in place by the end of September? I wish you well, but to me that seems like a barn door size risk. What are you doing to mitigate that risk?
So you're correct to identify that the timescales are relatively tight, but if we can achieve the timescales that we are planning, then we should be able to publish, complete the tender process, effectively evaluate, award, and allow sufficient time for mobilisation before the planned contract start date. There are always contingencies in the event that there are any unforeseen delays, and in this case, if we weren't able to complete and safely award and mobilise the service in time for the planned new contract start date, it will be possible to work with the incumbent provider to continue continuity of the existing services for a short period of time to enable that safe mobilisation to happen, should that absolutely be necessary. But as it stands, yes, timescales are tight, but they're planned in such a way as this is realistic and achievable.
Okay, thank you. And then finally, again, from a risk point of view, and indeed coupled in with the cost, there's around, if I'm right, 1,500-ish people that are using tech at the moment. And within the 5 years, you're hoping to raise that to 4,000. Somewhere in the paper, it says that 1,500 has been a pretty steady number. To jump to 4,000 in 5 years seems like quite a big ask, knowing nothing about it, but it just seems a big jump to do all in one go, and also not just from the number of people that you need included, but also from a staffing point of view. So again, what's the risk mitigation?
So I'll start on that. I think, so you're right, it's a big increase, but it's not an increase of 1,500 people are on sort of the Lifeline service now up to 4,000 odd people on the Lifeline service. It's essentially saying we'll maintain the existing Lifeline service, but we're having an entirely new service building on the pilot that's been done, which will bring in many people who currently don't receive any tech support, wouldn't be appropriate for the Lifeline service, but might well be appropriate for the Brain in Hand or for the Alexa or this range of other things. And the experience from other councils has been that, I mean, our numbers are prudent, I think is probably the best way to put it. So we've been able to look at a number of other councils that have gone down this route already. I think it's really important to be clear that while this is quite a big change for Lincolnshire, we're not exactly at the forefront nationally. So there are lots of other councils we can look at that have gone down this route and have been able to deliver the order of change, the order of increase that we are looking at. And as I say, I think the forecasts we put are quite prudent. But this is, I think, rather than looking at the 1,500 and saying we're growing that, more appropriate to say there are 12,000 people across the county who currently are funded by the council for formal care, and we're looking that perhaps about a quarter of them might start to use this care. And actually that's I think that puts it in a different picture. It will require capacity and staffing within the council. That's one of the things that we're working on to make sure that we have got the right capacity and the right staffing. It's not set out in this paper because this paper is about the procurement of the external partner, but I can give you assurance that we are well advanced and have been working with members. So we were briefing Councillor Clegg on this just yesterday about what the in-house capacity that will go alongside this will look like. So it's very much there. It's just not in this report because of the specific focus of today's report.
And my final question, Chairman, you'll be pleased to hear, is that Martin has already just mentioned about other councils, and I've sort of had a bit of a trawl through other councils, and absolutely they say that it's part of their package as far as adult social care services provide. However, the sort of figures that seem to be saved or potential savings don't really bear an awful lot of resemblance to the savings that the consultants that you've employed seem to be suggesting. So again, I'm a little bit concerned. I completely accept that in the right places, tech-enabled services are the way to go, but it's this: how much are we relying on these savings that are being that are in the paper? Thank you.
So I'll make a couple of points and then I'll ask Theo to come in. So the first is the savings aren't simply because some consultants have suggested some figures to us. So as we mentioned, we've been running a pilot and we've been evaluating the impact of that pilot, and we're increasingly there is a standard national methodology which has been touched on already, that you can look at an individual and say, without tech, this is what their care package would be, and we can cost that, and then we can say, with tech, this is what their care package costs, and we can compare the two. And it's the same basic methodology that we use for our reablement service to again demonstrate the impact of that. And looking at the local Lincolnshire data, colleagues will correct me if I get the figure slightly wrong, but I think we're finding that for every pound that we're spending, we're saving, in other words, we're reducing the care delivery cost by about £1.80. So Lincolnshire data is showing that for every pound spent, it saves £1.80 or so in terms of care costs. I say that's a pretty standard methodology being used by other councils across the country, and so we can talk to them and look at what they're doing. I think it's true to say that this is an emerging field, and some councils have been a little reluctant to publish their figures. However, I'll hand over to Theo now, because Theo has managed to engage with a number of councils who have now shared information that they perhaps might not be putting in the public domain, but which is able to give us a sense of what the real life savings are. So, Theo.
Yes, absolutely. What we have had is conversations with councils who have made this jump to using technology at a much earlier stage than us, and also some that are in the same boat in terms of looking at this currently, or maybe a couple of years ahead of us. And whilst, as Martin says absolutely correctly, they would be reluctant to have their accounts detailed in a report in Lincolnshire County Council, what they have showed us is enough to give us confidence about the projections that we've given. What we've also had is some previous work with a deliverer of technology-enabled care, in terms of they have been able to give us information across a number of different sites that they serve in terms of what their benefits projections have actually turned out to be, and that is what gives us some confidence about what we're projecting here.
Thank you, Councillor Woolley. Thank you. Oh, Martin.
Yeah, just for reassurance, obviously this is a view as of today. it's likely to change, and I think we need to be realistic it's changed, but the whole point of monitoring it, managing it, and having a really robust internal process is that we know the cohorts where we believe the impact on tech will have and take effect. So we'll be able to measure to see whether that is actually happening, and we'll be able to do that on a month by month basis to ensure that actually we are meeting the returns. And that's, I think, is another important point. It's not just we put this in and forget it. Actually, there's got to be a whole process around this to make sure that we are tracking those benefits and we are actually getting the return on what it is we're investing.
Thank you very much. Thank you, Councillor Woolley. That's one of my questions regarding the savings and what evidence, and I think you've just answered that. I take it there's no more questions because we give this a good go. I've got a little question. It's regarding the Dementia Watch. Are they actually fastened on, or are they easy to take off? Because obviously dementia patients, I know a little bit about dementia patients, they're able to take them off and take some keys out. Thank you.
So we've used different. There have been different straps that have been used for these. Also, there was a device that we used that wasn't a watch. It was more of a fob that individuals would wear, either as a sort of a necklace, bit like the press button that we talked about. It's got to be right for the individual, and if we find, as you mentioned, people might be irritated by a watch, or the pendant might not be right, there'll be another solution that might be suitable. It's got to be with the knowledge and the agreement of the individual, of course. One thing to say about the devices that we've talked about in here, in 5 years' time, we probably won't be talking about any of these devices. What we're looking at is, with the strategic partner, is a partner with an ability to test new technologies as they come along, as Martin has described, robustly sort of stress test them to the point where we're confident that Lincolnshire people are going to benefit from these, and they're going to be robust in all situations, including, people being irritated by them and wanting to take them off. So that evolving catalogue that meets our needs and that of the people of Lincolnshire, that's what we wanted to get to.
Thank you very much. Thank you for your questions and comments. That now concludes this discussion on the item. I move that the committee support the recommendations to the Executive Councillor of Adult Care and Health as detailed on page 39 of the report, namely that they approve proposed technology-enabled care, tech and service, and I move that the summary of the comments be shared with the Executive Councillor for their consideration. Do I have a seconder? Councillor Bean. Can we all show hands in favour, please? Yeah, that's unanimous. Thank you very much. Agenda item 7, short breaks and emergency provision contracts extension. This pre-decision scrutiny report can be found on pages 105 to 118 of the agenda pack. This report seeks approval for the short breaks and emergency provision contracts and extension. This decision is due to be considered by the Executive Council for Adult Care and Health between the 12th and the 16th of January 2026. The views of the Scrutiny Committee will be reported to the Executive Councillor as part of this consideration of the item. The report will be presented by Martin Parker and Carl Miller. Could you please present your report?
Thank you, Chair. This one actually will just be by me because this is a direct extension of what already exists and not a change in the service. So the report recommends a 7-month extension to the current contracts for short breaks and emergency respite provision. So these are currently being delivered by Making Space at Swallow Lodge, which is at North Hykeham, and Cedar House, which is in the Spalding area. Both of those properties are LCC-owned properties. This extension will allow time for us within adult social care to complete a full redesign and recommissioning of the service, which will be informed by stakeholder engagement and the market analysis. The current position that these services provide planned and emergency short breaks for adults with learning disability, autism, physical disabilities and complex needs. They are essential for sustaining family-based care arrangements and providing respite for unpaid carers. Both contracts are due to expire on the 31st of January 2026, and without an extension, there is a risk of the service disruption. The extension is required to ensure that continuity of care while we complete a targeted engagement with the service users and the carers, market shaping and procurement planning, and development of a redesigned model that better meets needs and improves flexibility. The financial overview in relation to this is that the current annual budget is 1.1 million across both sites. The proposed extension costs are circa 644k for the 7 months. This will be sitting within the existing budget envelope and below the relevant procurement thresholds requirements under the regulations. I suppose, you know, one of the challenging questions for us, and also probably no doubt to yourself, is why are we coming to you in January with a contract that ends at the end of January? And all I can say and apologise is that adult social care has been going on quite a journey in terms of how it's changing its philosophy and how it looks at commissioning and doing things, and there's a lot of things that we've been needing to join up, align, realign, and you've heard us talk about the day centres and community opportunities and how that's linked in with shared lives and how that's linked in with short breaks and how that's linked in with tech. All of these things are coming to us at the same time, and we've only got enough finite resources, and on some occasions we're going to need to just extend what we've already got to give us the time, the ability and the flexibility, as the paper says, to enable us to get to a position where we are ensuring that we are maximising people's independence, that they are safe, cared for, and living as independently as close to their communities as possible. And certainly this short breaks element, only having sites in North Hykeham and in the Spalding area, is not necessarily saying that's close to your community. If we've only got 2 sites that can provide that sort of offer, so we've got to do things differently and got to think about how we do that differently. And this 7-month extension will give us the time to do that. Because realistically, the strategic intent based on our kind of remodelling is the redesign will address issues identified in recent reviews, the limited flexibility in booking short breaks, the need for more community-based activities, building refurbishment and sensory improvements, and staffing consistency and communication. Chair, that's all I wish to go through in relation to this, because it is a direct award of what we are already delivering within those 2 sites to enable us to do a full commissioning review of short breaks, linked in with all the other advancements that we're looking to do within adult social care. So open to any questions.
Thank you very much, Martin. I would now invite members of the committee to make relevant statements or questions. Councillor Lee.
Thank you. Without going into the details of it, and I can't remember if it's since Martin came here or if it actually predates that, I had some casework around this, and I would absolutely agree with the need to review it and assess if it's meeting the need, because in the case of my casework, it really wasn't. And, you know, I'd welcome a look at it and see. That's not a criticism of what we've got, but it just didn't meet the need that my local resident, you know, had. So I'd absolutely support this.
Can I just respond to that? So thank you, Councillor. I appreciate that. Members of this committee will have heard me several times, both at this meeting and at previous meetings, comment that I inherited services that were good but somewhat traditional. And I think that this service is exactly one of those. There is an absolute need for people to be able to access short breaks, both on a planned and an emergency basis. It's a really, really important function. The current service isn't really meeting the need in the way that it should do. And therefore what we're looking to do is to ensure that the need really is met in ways that work for people, but we think that is likely to be different from the way the service is currently delivered. But I'm just conscious that there's always the risk when we're talking, you know, saying some of the things that we're saying, that people go, oh my goodness, they're going to take away my service. And I just want to be really clear that we are strongly aware of the need for short breaks, and we're looking to have the time to make sure that there's a really good short break service available to people at a cost that is appropriate and good value for money for the council. But it may well look different. But that's so I want to be reassuring. Change is likely to be coming, but it'll be change for the better. And I know that it's quite common people to find that difficult to believe. But this is one of those instances where we really are working in that direction.
If I could just come back briefly, the casework that I had, it was someone with a very profound need for that, both the carer and the individual, and what was available just wasn't suitable. And it was when the person got to 18 that was the problem. So I'm really glad that you're looking at this. Thank you.
Thank you, Councillor Lee. Thank you, Martin. Councillor Reeve.
Thank you for your report. Two aspects really. Page 111, 3.1, it describes it as being underutilised capacity, but there's no actual figures on there. And I just wondered how much we're looking at per room cost to the council when there's no actual figures there. It just states an underutilised capacity. And then also following on from that, looking at a cost from Cedar House of £400,000 per year, and we're utilising 6 out of the 7 beds there on a constant basis. But then Swallow Lodge, 600,000 for 8 out of 8. That's quite a big jump from one to the other for 1 or 2 extra beds. Is there a reason behind any of that? Thank you.
Yes, thank you. So first of all, in terms of the utilisation, the current utilisation, the challenges really are about when people choose to take their breaks, which tend to be focused around weekends and key holiday periods. So there is some underutilisation predominantly on weekdays at the settings. It fluctuates during the course of the year, but overall utilisation, I believe, is and work is ongoing to try and working with the provider and the people who access the services to try and maximise utilisation of the existing services. But it's rising to around 70% utilisation or occupancy at the settings. The differential in the costs between Cedar House and Swallow Lodge are historic, linked to the original tender process where these contracts were let. They were let as separate lots, originally delivered by 2 separate providers. And so there's a historic element linked to the unit costs derived through the original competitive tender process for the 2 settings. There's also a factor linked to the overall expenditure at Swallow Lodge being higher as a consequence that is a setting where there is the capability to support more complex and profound needs, and there is additional support going into the people accessing the services at that site, which also affects the overall cost for the services delivered at the setting.
Thank you.
Thank you, Councillor Reeve. Councillor Cullen.
Thank you very much, Chair. Just a hypothetical question, I think, but I think it's important to be asked. What are the key risks if, for whatever reason, the extension was not approved, and how would any service disruption be avoided, prevented, please?
So if there wasn't a decision to extend, then the service would stop and we would be unable to meet our statutory obligations in terms of meeting people's needs. Were the decision to be that this was not the route that the council wished to go through, if Councillor Clegg were to say no to this report, and of course he will have been listening to this debate, we would very rapidly need to find some kind of alternative solution, but there would need to be a solution. It's not a service that, if it stops, well, that's unfortunate. There needs to be a short break service.
Thank you very much. Thank you.
Thank you, Councillor Cullen. Councillor Bean.
Thank you. I noticed that both the sites are basically in the south of the county. I'm just wondering, are there any plans to procure a site in the north of the county for residents who live in that area? And if there isn't, why isn't there?
So that's the purpose of the redesign. So as this issue that the current service doesn't really meet the needs of Lincolnshire people. It doesn't really meet the needs of Lincolnshire people, both in terms of the geography, as you've just described, or in terms of the model of care that's being provided. And therefore, part of the redesign is to see, well, what is it? You know, we're starting with the needs of Lincolnshire people. What's the best way to address those needs? And a consideration of there are people in the north of the county who need this service. What's the best way for us to deal with that? And so in due course, we will bring forward a report recommending a way forward, because there'll need to be a procurement and the like, and that therefore will come to Councillor Clegg for decision, and therefore will come to scrutiny for consideration. And we will set out there what our approach is. So at the moment, I can't give you an answer because we haven't got there yet, but that certainly is a factor to be built into the new model to make sure that it does meet the needs of people from the north of the county in a better way than the current arrangement does.
Thank you. Reassuring.
Thank you, Councillor Bean. Councillor Cook.
Thank you, Chairman. I think, like Councillor, it is Councillor Lee. I do agree with Councillor Lee. I welcome the review, and I look forward to that coming back to this committee in due course with the findings, and also, the point you've just raised is very pertinent around, accessibility in terms of, we are a huge geographic county. And I think, Martin, you probably said it far more eloquently than me. When you started, and I remember being on this committee now for a couple of years, some of our services were quite traditional and old-fashioned, and I know we've certainly been modernising them, particularly over the last couple of years, and this is one that also needs that attention as well, which is why the review will come in really handy. I think my question is probably a bit more on the wider scale, in terms of how well are these sort of short breaks linked into the wider preventative and community-based pathways, rather than being used as sort of crises response as such?
It's a really good point, and that is exactly one of the factors that we are building into the review, because I think the answer has been that they haven't been particularly well built in, and I think that there has been a bit of a sense that the preventative services have been sort of over here, and the delivery services have been over there, and the connection between the two hasn't always been as strong as it ought to be, and it is one of those things that we are actively looking at, and therefore, in a sense, short breaks is precisely a preventative service, and therefore thinking about it in that context should allow us to be much more effective, and that's part of the work that we're doing. So I can't give you a definitive answer other than to say it's absolutely part of the work that we're doing, and we will be able to give you a definitive answer when we come forward with the recommendations for the future. And I say, given that we're having a 7-month extension, coming forward with recommendations for the future is going to have to be quite soon.
Thank you, Councillor Cook.
Yeah, sorry.
Let me just go to Councillor Woolley first, if that's okay. Councillor Woolley.
Sorry, Martin, do you want to
No,
just
I was only going to say that Martin's absolutely right. The recommendations for the recommissioning are due to come back on the 27th of Feb, so it's not that long to wait.
Thank you, Chairman. Just a, small point to me, but probably to those people involved, a very large point. It's a bit disappointing to see that a lack of outings and external activities on offer. And it's more of a comment than anything, that my expectation would be that if I had a short break, I would be doing things. And so I would just make a plea that whatever the, when you work with the contractors or those that are involved, that those sorts of things are taken into account, because that should be absolutely just a matter of course. Thank you.
All I can say is yes.
Thank you, Councillor Woolley, and thank you, Martin. Councillor Lee.
Thanks. I've just found that casework, Martin, and it goes back to October 2023, the last email. I'm going to contact that woman this afternoon. I'm going to email her and find out where they are. And I wondered if I could have, if it's appropriate now or not, if there's any more information I could have about potential alternatives, because she really was at her wit's end, and we just couldn't find anything that suited. So anything I could have would be helpful.
would it be possible to email it out to Councillor Lee if that's okay? Thank you.
I'm sure we can sort something out.
I take it there's no more questions. Thank you very much. I've just got one short question. What systems are now in place to ensure recommissioning starts earlier enough in the future so that the council is not repeatedly reliant on contract extensions to maintain continuity of service? Thank you.
We do have had and will continue to have a regularly monitored procurement pipeline, which covers and commissioning pipeline, which covers all of the services for which we currently externally commission and procure. Clearly, this particular recommendation comes late in the day, much later than we would like, and is the result of delays in the commissioning programme, some of which I think were avoidable. Certain other factors, you know, we couldn't plan for at the outset. But I would hope I can reassure you that we are actively planning and preparing to work and allocate resources to our commissioning and procurement pipeline in such a way that we aren't coming to this committee with little notice to request extensions to contracts to facilitate recommissioning exercises as we move forward.
Thank you, Carl. As long as we can tighten up a little bit better, that'd be fantastic. Thank you. Thank you for your questions and comments. This now concludes this discussion on the item. I move that committee support the recommendations to the Executive Councillor for Adult Care and Health, as detailed on page 105 of the report, namely that they approve the proposed short breaks and emergency provision contract extension, and I move that the summary of the comments be shared with the Executive Councillor for their consideration. Do I have a seconder? Councillor Cullen. Could I have a show of hands, please, in favour? That's unanimous. Thank you very much for that. Agenda item 8. Adult Care and Public Health Scrutiny Committee Work Programme. This is the last item on today's agenda, and the report can be found on pages 119 to 126 of the agenda pack. This item enables the committee to comment on the content of its work programme. The report will be presented by Hannah Colclough, Scrutiny Officer. Thank you, Hannah.
Thank you, Chairman. So on the next meeting on the 28th of January, we have the Adult Care and Community Wellbeing Budget Proposals 26-27 and the ILS Future Arrangements, both of which are for executive pre-decision for the 3rd of February. We'll have the home-based reablement recommissioning, which will be an executive councillor decision between the 2nd and the 6th of February. We have the Director of Public Health Annual Report, and we also have the Future of Mental Health and Wellbeing Community Investment Fund and the Memory Support Service items. Thank you.
Thank you for your presentation, Hannah. I would now like to invite members of the committee to make any relevant statements. Councillor Lee.
Can we have a lunch break and a buffet, please?
Maybe next time. Councillor Cook.
Thank you, Chairman. I don't know if this is the last meeting or not, but can I put on record our thanks to Simon Evans, who is retiring soon, for his sterling work for Lincolnshire County Council.
Absolutely, Councillor Cook. And I echo your comments and I wish you well in the future, Simon. So if anybody else, do we need a show of hands to put this on record, or are we just happy like this? Perfect. Thank you very much, Simon. Do we have any more questions or comments on this item? No. Thank you very much. This now concludes this item. To review the item which we've just done, I move that we note the report and approve the existing work programme. Does anyone dissent? If so, please indicate now by raising your hand. Thank you. This is agreed. That now concludes this meeting. Thank you so much.